Alright, I'm Dr. Michelle Pengel. This is the cranial nerve examination 1 through 12, and today's date is June 23rd, 2016. The first exam, we're going to check for restrictions, so cover one nostril and breathe in. Cover the other nostril and breathe in. We're checking for any restrictions. Is it the same on both sides? Alright, close your eyes. Close your eyes. We're going to do the same thing, block one nostril. Breathe in. Keep your eyes closed and block the other nostril. Breathe in. Okay, you can open your eyes. Can you identify that sin?
Same.
Was it the same on both sides?
Yes.
Alright, moving on to the next test. That was cranial nerve test number 1 for the olfactory nerve. This is cranial nerve test 2. I'm going to dim the lights. So, as much as we can. I'm going to focus my ophthalmoscope. And then turn the light on. I'm going to check his eyes. Check his retina. We're checking for any exudates, papilledema, eggy nicking, and so on. I'm going to check the other eye. Alright. Alright, so I'm going to have you stare at my sternum. And you're going to cover one eye, and you're going to tell me what number I'm holding up.
1, 2.
Yep.
1, 2. Hold on.
Alright, cover the other eye.
1. Hold on. 1, 2. Hold on.
Alright, good job. So I'm going to have you stare at the windows, and we're going to check for any pupillary fatigue. So, I need my light is ready. So I'm going to hold this light in your eye, checking for pupillary fatigue. Alright. We're going to check from the temporal side, so we're going to check 3 times from the temporal side. Okay, constriction is good. Good. So now we're going to check for direct and consensual. I'm going to have you stare at the wall. We're checking to see if both pupils constrict. And make sure there's no quivering. So we're going to check both pupils. Okay, other side. Looks good. Keep staring at the wall. Alright, good job. If it was abnormal, we would shine the light in the right eye and either eye would constrict, but both of his eyes constricted both times. So, moving on to the next test. So we're going to have you close your eyes. We're checking for blepharospasm, which he doesn't have any of. You can open your eyes again. And have you stare at the wall, checking for blepharospasm and for ptosis, sorry. So he's good on both of those. We're going to check convergence and accommodation. So he's going to follow my finger, and this is checking for, we're going to do convergence and accommodation. So I'm going to follow my finger with my finger. Good job. Good job. Okay, so now I'm going to have you do the his eye movements were smooth, and he followed my fingers. So we're going to do the H in space, which we're also again looking for smooth eye movements and for his eyes to be moving together. We're going to do it 3 times on my finger. And then we're also going to do the X in space. So follow my finger again. Great job. So for the H in space, we're checking for the end stage nystagmus, which he did not have any of. So moving on to the next test. This is going to be cranial nerve 5. So I'm going to test on your forearm. First, this is for the sensory, for pain. So did you feel that? Okay, I'm going to do it on your face 3 times. Did you feel that? Did you feel that? Was it the same on both sides? Did you feel that? Did you feel that? We're going to try to do it through his beard as best we can. Was it the same on your cheeks for both sides? Okay. Did you feel that? Did you feel that? Was it the same on both sides? Same from top to bottom? Yes. Alright. Next test. We're going to do the cotton ball. So, did you feel that? Did you feel that? Same on both sides? Did you feel that? Did you feel that? Same on both sides? Did you feel that? Did you feel that? Same on both sides? Same from top to bottom? Alright. So we're going to do muscle tone. So if you could clench your jaw against my hands. Like, bite down. And then again. Okay, good job. So that was a bilateral test, which we did at the same time. So now we're testing for cranial nerve 7. I'm going to have you raise your eyebrows up. Great. And then puff up your cheeks. Like this. And then close your eyes as tight as you can. Clench them. You can let go of your cheeks. Clench your eyes. Okay. And smile. Alright. Now open your eyes. Imagine Brandon naked. Okay, good. Alright, we're moving on to cranial nerve 8. This is cochleovestibular nerve. And I'm going to have you let me know when you can hear the sounds that I'm making. Can you hear that? How many you can't hear it? Okay. Can you hear it? Tell me when you can't hear it. Okay. Was it louder in one ear or the other? Okay, which ear? Your left ear? Okay, so if it's louder in one ear, then we're going to check for bone conduction and air conduction. And so we're going to check on his left ear for bone conduction. Can you hear this? No? Not at all? Okay. Okay, so you can't, okay, let's try that again. You can hear it? Okay, so tell me when it stops.
Stop.
Okay, good job. If the air conduction is greater than the bone conduction, then it means it lateralized to the left side, and we're moving on to the next thing. If the bone conduction was greater than the air conduction, then it would be a conduction loss on the left side. I'm sorry. Yes, air conduction loss on the left side. So we're going to be moving on. So we're going to have you stand up now. I'm going to have you walk heel to toe like this with your eyes open, just at like 3 or 4 steps. And then I'm going to watch. Good job. Alright, great job. Now we're going to have you do the same thing with your eyes closed. I'm going to stand by you just in clarification as it falls. Heel to toe. Okay, great job. Alright, I'm going to have you come back over here. You can sit down again. We're going to have you look at the wall, checking for any nystagmus, which is negative. This is cranial nerve test number 12, and we're going to test for, use a pen light to look in his mouth. If you open your mouth and say, well, just open your mouth, I'm going to check your tongue right now. We're checking for atrophy on one side or the other. Nope. Any gesticulations, also negative. Okay, so we're going to have you stick your tongue out. And we're looking for any deviation, which I do not see. And then if he did have tongue deviation, then the lesion would be on the same side as the deviation. Moving on to the next test. I'm gonna have you close your mouth and press your tongue on each side of your cheek, and then I'm gonna pressure against it. So press your tongue up against my hand. Great job. Push my tongue against this hand. Okay, great job. So I'm gonna check for cranial nerve 9 and 10. We're gonna do for palate elevation. So I'm gonna have you open your mouth. I'm gonna look inside with the light and see if your palate is even on each side. It looks great. Then I'm gonna have you stick your tongue out and say ah, ah, ah 4 times. Okay, great. So we're checking his uvula for any deviation when he does that, and it looked okay. So then we're going to, if he did have uvula deviation, the lesion would be on the opposite side of the deviation. Moving on to the next test, we're gonna check the gag reflex bilaterally. So if you're okay by okay, so it's negative on the right side. And also negative on the left side, which is normal. It's okay that he doesn't have one. So we're testing cranial nerve number 11. We're going to test trapezius muscle strength. So raise your shoulders up against my pressure of my arms. Great job. It's a bilateral test. If you could do, so I'm going to have you look to the left and right up against my arms. So press up against here, twist your head, press, okay. Twist your head and press. Okay, great job. So this is the end of the cranial nerve examination 1 through 12.